On July 28, 2021, my father walked into the emergency room with COVID-19. For weeks, my family and I sat by as we watched the standard of procedure bring him closer and closer to death. And even when we were told there was no other options, all of our requests for any alternative treatments were continuously denied.
You know what? The standard of care, he should have been vaccinated as well.
Well, that's what you guys heard Carl to tell us too.
We'll leave it at that. We're doing the best we can. I assure you.
Because he was denied treatment. Then we're begging you to try this on our father.
I understand.
But do you really?
I do.
I feel like I might start publishing this information to my platform.
Despite being shot down repeatedly by the hospital, I was able to connect with several experts around the world who encouraged me to keep fighting for the treatments that our government is suppressing. After weeks of non-stop research, I gained access to the real-time meta-analysis on the drug ivermectin, which now includes 81 studies, 61 of them peer-reviewed, and 33 randomized controlled trials. The drug is FDA approved and has been used safely in humans for decades around the world. In 2015, it won the Nobel Prize. It is cheap and widely available, and it has far more science behind it than any other drug we are using to treat COVID. Yet for some reason, the FDA is blocking the hospitals from filling prescriptions, and the mainstream media is misleading people into thinking it's not safe for humans. When I first learned this, I couldn't believe it myself either. How could there be a drug with so much science behind it and I'm being told there's no other options? So I looked up the email format for a hospital employee and sent the studies to all of my dad's doctors. I also printed them out and brought them in person and demanded my dad the right to try. On August 13th, he became the first person that they ever treated with ivermectin. He received 12 milligrams a day for 5 days, and within 2 weeks he was on the road to the miraculous recovery that we all witnessed. Yet for some reason, when the family in the room next door was begging to try, they were told they weren't allowed because the FDA put a ban on it September 2nd. We are 2 years into this pandemic. Why is the government still forcing dangerous treatments like remdesivir and banning the safe and effective ones? Not only are they banning them, but any doctor or scientist who speaks about them is being censored and deplatformed. Our medical professionals who are risking their lives to save us are being forced to watch patients die while there's a safe and effective treatment in the pharmacy right downstairs. They are understaffed and overworked because we fired our heroes over a vaccine that clearly doesn't stop the spread. I know a lot of people will find this shocking and offensive, but I just can't go on enjoying our victory without sharing the truth with the world. Over the last few months, I've worked directly with dozens of families who are experiencing the same problems in hospitals around the country.
So we've had 7 doses of ivermectin. She has dramatically increased. This is how we saved my wife, Alyssa Goldstein.
This isn't a conspiracy. This is actually happening, and it could be you or your loved one next. Over 20 countries have already adopted ivermectin as treatment. This is the United States of America. Why are people on their deathbeds being denied access to life-saving treatments? Why does it feel like the people who are supposed to be protecting us are purposely trying to cover up the medicine that works?
So why will you not commit to sharing everything open, unredacted with this Congress?
So here's an example.
Dr. Fauci, this hearing is critically important to the American people. There are millions of people infected with the COVID virus. Right. It is impacting every part of our economy. Every family is asking for answers to critical questions.
Leaked documents from the Department of Defense state that this virus was created by the American EcoHealth Alliance at the Wuhan Institute of Virology and was then intentionally concealed when the virus managed to escape the lab and take the lives of millions. They also state that ivermectin was identified as a cure back in April of 2020 for all phases of the disease, yet it is still impossible for us to get. Why? Is it because no money can be made off this cheap off-patent drug? Pfizer's expected to bring in $54 billion this year, and they are also responsible for the largest healthcare fraud settlement in U.S. history. Would a cheap and effective treatment get in the way of Big Pharma's profits? Have the people in power really been truthful?
Biden wants to inoculate as many people as possible. The drug companies, the food companies, the vaccine companies, they pay us hundreds of millions of dollars a year to hire and keep the reviewers to approve their products. If they can get every person required at an annual vaccine, that is a recurring return of money.
This is a pandemic of the unvaccinated. We've been patient, but our patience is wearing thin, and your refusal has cost all of us.
The efficacy of ivermectin in all of these phases is just truly remarkable. We know how effective it is.
Any pharmaceutical company can manufacture.
It's out of patent and not high profit.
This becomes part of the issue with highlighting it, right?
And there's no money to be made off ivermectin.
They cannot grant an emergency use authorization if there is an existing treatment that is safe and effective, right? The vaccines would not have been authorized if ivermectin was understood to be what it is. And that, I have the sense, is the key thing that explains everything else.
They are. The CDC and FDA are the sponsors of the U.S. vaccine program. Now Bobby Kennedy has his book out, The Real Anthony Fauci. I can tell you that if you want to find the evidence that Moderna was working on the vaccine before the virus ever emanated out of the lab, if you wanted to find the collusions and how all this was organized, they published this. It says it's going to be a coronavirus. It's going to come over here to the United States. It's going to shut down cities and frighten people. There's going to be confusion regarding a drug, hydroxychloroquine or ivermectin. And we're going to utilize all that in order to railroad the population into mass vaccination. It's laid out in the Johns Hopkins SPARS pandemic training seminar.
It's just hard to imagine being a person denying treatment and then to cast this judgment on them. Why weren't you vaccinated? We're not going to treat you.
You know what? The standard of care, he should have been vaccinated as well.
I mean, but this is what's happening to a lot of patients.
That's what's happened to 800,000 Americans.
And so this is why you believe that at least 50% of those deaths could have been prevented.
That was in November of 2020 under sworn testimony. Maybe it's 90% now if we got what you got.
The facts are clear. The NIH did fund gain-of-function research in Wuhan despite your protestations. Viruses not found in nature were created, and yes, they gained in infectivity. Will you today finally take some responsibility for funding gain-of-function research in Wuhan?
I disagree with so many of the things that you've said.
History will figure that out on its own.
My family and I are forever grateful that God spared our father's life. We're grateful for the community who came through when we needed them most, for all the healthcare heroes and people fighting on the front lines, for the doctors who risked their careers to go off protocol, and for everyone out there who's used their platform to help spread the truth. If it wasn't for you guys, my family would have never had the courage to fight like we did. My heart goes out to everyone who's suffered from this virus, and to all the families whose loved ones never made it home. For everyone fighting for their life right now, I pray that this video reaches your family, and that you guys find the strength to never give up. Something is terribly wrong with what's going on in the world right now, and I hope you all can feel it. Scary patterns from the past appear to be repeating.
I want to be very clear.
This is not about freedom or personal choice.
And the places these paths lead to are never safe for anyone.
3 people have escaped from the Howard Springs COVID quarantine facility.
Another barrage before dawn.
It also gives Canadian banks the ability to freeze bank accounts without a warrant of anyone participating in this road blockade.
I know this video has the potential to divide, but I pray that instead it can unite and guide us through this pivotal moment in history.
I still have a dream.
It's all they ever talk about. Politicians and the media always pushing the things that separate us, things that make us different. That's the way the ruling class operates in any society. They divide the rest of the people. They keep the lower and the middle classes fighting with each other so that they, the rich, can run off with all the fucking money. Fairly simple thing. Fairly simple thing. Happens to work. Anything that's different about us, you know that's what they're pushing at you. Racial differences, religious, ethnic, national backgrounds, jobs, income, education, social status, sexuality. Anything they can do to keep us fighting with each other so that they can keep going to the bank.
The unvaccinated overcrowd our hospitals, are overrunning emergency rooms and intensive care units.
Whenever a political elite pushes an agenda this hard and resorts to extortion and manipulation to get their way, you can almost always be sure your benefit is definitely not what they had at heart.
We need more money to plan for the second pandemic. There's going to be another pandemic. We have to think ahead. And that's not something the last outfit did very well. That's something we've been doing fairly well. That's why we need the money. There are people who are dying and who will die who didn't have to. What more do you need to see?